Welcome to the 477th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. We are having one of the hottest Mays I have ever seen here. My car said 170 degrees, 107, not 170, but 107 here in Florida. That we usually have the 90s, you know, we're like 80 to 90 for all of summer, but we're getting some hot weather and no rain, so it's a little bit on the hot side down here, but guess what? It's almost mango season. June is when we can start to harvest. We're probably going to have some mangoes on our tree. Unfortunately, a lot blew off during some of these windy episodes that we had in the winter. But coming back from the hurricane of 2 years, I think that's pretty good. So we might get 20, 30 mangoes out of the yard. That would be nice. I've got a few eggplants off an eggplant plant, so that's been fun. Herbs are growing. Found a few mango trees that people don't eat their mangoes, so we'll harvest a few of those. So it's exciting times in the fruit season in Florida. We have some white sapodillas, which are very, very sweet, like kind of like a brown sugar and pear type flavor together. So some of those are growing on the tree. So they're exciting. Injury update. Thank you for your emails and concerns after the Cruel Jill post. It's funny, I looked at the podcast. It said episode 276. Actually, it's 476. This is episode 477. So a little typo in the show notes. I don't know if I spit it out that way or not. Hard to tell. But yeah, ankle's coming along. Took a few days off to go celebrate birthdays in Texas. And my grandson had a bounce house, Car's bounce house. And of course, I joined in. And I got to tell you, that is a new ankle therapy that may need to be published. I came out of the bounce house, and it's like, you know what? It loosened some tissue up that needed to be loosened up. Felt great after the bounce house, like better than I had in days, weeks, months. And it persisted, got excited, came home, did a 4-mile walk run. Still felt pretty good, almost afraid to push the envelope. Then I did. A little bit more sore today, but still coming along. So rapid forward progress. Have good hopes for the Silver Rush 50. We're going to go out and do a practice run on Hope Pass the end of June. So I'm trying to get ready for that. So we'll have some celery field hill training. Start working up my mileage a little bit. Strength training. So I don't have a bounce house. But what I do have is a Bonsu ball, that half moon ball. So I have been marching, kind of jogging on that a little bit. Seems to be similar. And there's also I'm ordering for our mobility class, a thing called a sand dune, which simulates running on sand. Because a few weeks ago when we were at the beach, that also helped my ankles. So I'm going to add that in the rehab. I am utilizing a power plate. If you haven't heard of those, it's a high vibration type plate that helps with, you maintain your balance and do some squats and toe raises and things like that. Some studies that suggest that you can build bone and muscle, adds resistance because, again, you're a little bit unstable while it vibrates. So hopefully that will contribute to my healing process, and we'll go from there. Can only do what you can do, but the idea is to take a weak ankle and come out with a better ankle and a much stronger body. So that is my goal. I tend to stay positive for that, and that's where we are. I also started going up the hill on the treadmill, so 15% grade, and started doing that walk. That doesn't bother my ankle either, so, we'll add mileage one way or another. A new potential patient came into my practice this week because she was having problems with weight loss and unable to eat and abdominal discomfort, and she'd had multiple surgical procedures done that left her worse than she was, and she was looking for some help with her nutrition. She was not plant-based. She walked into the office. She was concerned about how much weight she'd lost. The reality of it is she was closer to being a normal body mass where she is presently. So her perception of the degree of weight loss was somewhat off. She felt like she was skin and bone and needed to put weight on. She didn't think about, like, what kind of weight do I want to put on? Do I just want to put weight on for the, if I weigh better, if I weigh more, I'll feel better. And, a lot of us, myself included, you think if you can sit up and take nourishment, you're going to be okay. And so when people become older and they can't eat, or food bothers their stomach, or they lose weight, then the fear is that, the end is near, I'm losing weight, I'm losing ground, I'm not going to be able to get my strength back. And those are all valid concerns. But the question is, obviously, why is someone losing weight, and did they have weight to lose? And, turns out that person was overweight to start with and then got ill and lost weight. And when people lose weight, especially, once they're over, we'll say 50, they lose fat mass, and they realize then just how little muscle mass is actually left. So it's not, and most likely she did lose muscle mass when she was ill and, not able to do things. But people lose a lot more fat mass. They've already lost the muscle, and so when they lose the fat, then, you can really see how bad the problem actually is. So the idea would be to have her put on a little muscle instead of just putting on weight by eating high-fat foods. The other thing is attack why. What is the problem? The big question was our approach the right one for her? And my approach would be find the cause of her inability to eat. Obviously, she'd had some surgical insults that changed her gut microbiome. But first off was that she smoked. She was a lifelong smoker. And smoking affects the blood vessels everywhere. I could tell she was a lifelong smoker by looking at her when she came in. She had the smoker's lips. You have the wrinkles around your lips. You have certain people that smoked all their lives. They have the look, right? Because of the lack of blood flow to the tiny, tiny vessels and capillaries, typically in the face and other places. So she was a lifelong smoker, but the big risk, in my opinion, was she suffering from lack of blood flow to her gut? So was she unable to actually absorb calories and process nutrients because her gut actually wasn't working because of lack of blood flow? And that's actually a real thing, and it's a difficult thing to fix. It's certainly not really fixable surgically. People have tried. Certainly when people get to the point where they have to have, like, part of the bowel dies because there's not enough blood to it, then they have to have a surgical correction. Of course, that leads to more gut problems, but it can be life-saving. But turning the whole thing around is somewhat difficult. And in my opinion, the only way that you could turn something like that around would be to try to reverse her vascular disease in her gut like you would reverse cardiovascular disease through plant-based nutrition. So that was first thing that came, well, can I get a box from someplace that gives me the things? And it's like, no. The first thing you have to do is decide whether or not you want to be involved, and do you know where your kitchen is, and do you know how to use it? Because that's going to be your cure. And as far as weight gain, we can help you gain weight and work your way through, in restoring your gut microbiome, but we're going to have to do some movement here to actually start to build muscle mass. We're not just interested in putting fat mass on people. It takes me back to why I changed the practice in the first place, in that most of what I did, most of my early years in practice, and most was what is done in allopathic medicine, is put a Band-Aid on disease. We don't fix it. We don't look at the root cause. We fix the number and hope that people will do better, but we don't turn the clock back as far as blood pressure, diabetes, vascular disease. We just put a Band-Aid on it, as well as obesity. And most of this can be done right in the home itself by changing your nutrition and your movement pattern. One of the studies that I looked at, looking at knee replacements, and most of the people that get knee replacements are overweight. I'm always asked, how are your knees? Because I run. My knees are fine. I don't have any arthritis in my knees. Most runners don't have much in the way of arthritis in their knees. And I've talked before on podcasts, injuries that occurred when you're 17 don't just spring up when you're 75 and cause your bad knees. It's a lifelong inflammatory process by what people eat and the movement that they do or don't do for the most part. So replacing a knee in an overweight person may result in decreasing their pain, but it doesn't often result in improving their mobility. And according to this study, 20% of patients actually develop chronic pain after a joint replacement. So you don't talk about that. So you had pain, you got a joint replacement to fix the pain, but now you got a new pain and decreased mobility. And in some of those people, even doing exercises to align the knee and maintenance of posture and lower extremity strengthening, balance, and stability exercise don't do much to help the pain. And in that respect, my thought would be, well, they're still inflamed. So the thing that caused the pain in the first place, inflammation, is probably still there. Again, most people get 6 weeks of PT, 8 weeks of physical therapy, and then they're on their own and they never do the physical therapy afterwards. So how much did they actually really gain as far as posture and muscle building and things? But we come back to the knee replacement is not the joint replacement is never better than the original equipment. Sometimes it has to be done in order to keep the person mobile, that things have deteriorated so bad. I'm not saying that it doesn't have a place, but just like my ankle, we should make the person whole again and make them the best shape that they possibly are, potentially before the knee surgery, so that they can get through and have less chance of having postural issues, balance issues, and having chronic pain. But we're very quick to jump on, let's just fix this as physicians, put the joint in, and go on our merry way. We haven't had an Alzheimer's drug or a dementia drug come down the pike. Most people that get Alzheimer's or dementia end up either dying of pneumonia because they can't clear their secretions, or of a fall and breaking a hip and not being able to recover from it and getting a pneumonia. However, back to exercise, strength training, and aerobic activity. So both weight training and aerobic activity has been associated with preserved brain mass size. So, and improved memory, more so than any other medication. So why aren't we entering, it's a must to have everybody continue to be active if you want to preserve your brain function and your mobility. So we have loss of muscle mass, increased risk of falls, increased risk of dementia, when again, the root cause may very well be to preserve mitochondrial function so that we can metabolize our nutrients and, provide nutrients that dilate blood vessels and preserve blood flow in these people. So I don't know about you, but when I get down about doing my rehab, all I have to think about is some of these things, and it drives me to the weight room to increase my strength training and mobility. And I'm thankful for that because, again, I could get in a bounce house and bounce around and have a squirt gun fight with my 4-year-old grandson and not have to sit and watch. I will tell you that the new pumping squirt guns are much improvement over the 1970s little squirt guns. You can have a proper squirt gun fight with some of these things. Thank you, 3-0. So Ozempic and other weight loss drugs that are out there are the biggest boom to hit the market since statins, and they've surpassed statins, and there's a wait list to get the drugs, and they're expensive and nobody cares. But the reality of it is most people are getting about a 10 to 15% weight loss. And that's at the risk of the side effects associated with nausea, gastroparesis. But the thing that's still continues to bother me is the effects that it has on people's brain. It works on glucagon-like peptide receptors, which are in the brainstem and various parts of the brain that also control things like mood, depression, as well as other autonomic nervous system function. And now people are starting to hit walls with the weight loss of these medications. And now in Nature magazine this month, they actually looked at yet a new medication which adds what's called an NMDA receptor blocker. And that an NMDA receptor blocker is a lot of places in the brain. One of the drugs associated with that, it'd be ketamine. So that ketamine is used as a recreational drug, but it's also used to induce anesthesia. And it started at, Merck tried to introduce this as a weight loss drug way back and abandoned it because of all the side effects, memory loss, hallucinations, depression, all kinds of problems. But this newfangled hook it onto a GLP-1 receptor blocker, and then that crosses the blood-brain barrier, and then this NMDA molecule is supposed to break off and potentiate further weight loss. Just a few added side effects: bladder pain and function, kidney disease, ulcers, convulsions, epilepsy, again, memory deficit. So what possibly could go wrong? But people don't seem to be worried about this. They just seem to be looking at, again, what is the number on the scale? When, again, plant-based nutrition and exercise, if followed, not necessarily easy, but if followed and planned, would work very, very well without the side effects. So in my opinion, the pharmaceutical industry has put, they have obesity affects a large portion of the population and just keeps growing. So we're not changing what foods is out there. We're not changing nutrition education. We're just developing new medications at high cost with high side effects and telling people that they have some sort of disorder that they need to take these medications for the rest of their life. So we're not fixing the underlying cause. We're just treating the side effect of the number on the scale. In training for my upcoming races, my coach is having me do various forms of thinking, mindset on how I want to approach the race, planning the race, sections of it. And again, I've talked in the past about breaking things down into sections during a race rather than looking at the whole thing. And obviously, the further that you go, the more that you have to break things down and the more complicated it gets. But one of the things that we discussed this week was things that you focus on and things that are distractions. And we looked at that, in a race. So things that may distract you from your ultimate goal. Some people listen to music when they run as a distraction from discomfort, or some people don't like to listen to their breath work. But it also can be a distraction, for example, in that you don't hear people around you coming upon you. You may miss a turn because you're zoned out of the music, or you may not be paying attention to things that you need to focus on, such as hydration, again, navigation, times, other people. So distractions can be detrimental in achieving a goal of a race. But let's put that on to weight loss. Distractions are a huge detriment to weight loss. I have people say, I have no idea what is causing me not to lose weight. No idea whatsoever. And yet they've had success in the past, and I cannot remember what was different then versus now. And so obviously there are distractions that have caused loss of focus of what was working and what's not working now. Some people are distracted by more things than other people. So you have to know what your distractions are. Some people call those distractions triggers. If the bakery is a distraction, so you go into the grocery store to buy vegetables, but you get sucked into the bakery and start looking at things, you forget your vegetable list, but then you've bought sweets, that is a distraction. Same way with going to restaurants. You go out with friends, you drop your guard because you're with other people, and the next thing you know, you're ordering or tasting things that you would not have done in the past. So it comes down to planning and knowing what your distractions are and how do you avoid those. It may be such that until you get things practiced better, you can't do certain things like go out to dinner or go to places where you will have a temptation. Don't go down into the bakery. Make sure that you go straight down an aisle that, has the baby aisle, and so there's nothing to get down there if you don't have babies, and so you go down and you get to the produce aisle. But you have to know what your distractions are and try to avoid them, or again, back to putting a fence around those things so that it's not causing a problem. I went to a graduation party this weekend. Again, there were many distractions there as far as things you could get into, cookies and candies and treats and things like that. It's not something that I'm distracted by because it's not what I do. If it was, I would have avoided that area and stayed outside or stayed in the place where I could talk to people and not have to be distracted by foods that I might get into. If I have a race plan, it's my race plan, and I'm much more likely to be successful if I have it written out in what I'm going to do, as opposed to I'll wake up and see how I feel. There are some people that are very successful about running how they feel each day, and most of the time those people don't have other distractions. But if you have a job and other commitments and you need to fit your exercise or your nutrition into a certain time slot, you need to do a little planning. So menu planning is an example and as a way of nutrition. If it's not on the menu, it's not something that you're going to do because it's not on your plan. So, I know a lot of people, there are calorie, people think that they count calories. But that's an after the fact if you're counting calories. They look back and 100% of the time, people don't recall all the things that they've eaten, tasted, touched. And so those are notoriously off. So the apps just don't work. They're uniformly not successful because by the time you're counting the calories, it's too late. You've already consumed them. The idea is to have a plan and continue to stick with the plan until you've achieved your goals. And then potentially you can adjust the plan to see how that works out for you. Sometimes you do have to rework a plan. It's not 100%. You can't stick to things. But for the most part, you want to be able to assess what's going right, what's going wrong, and then adjust it. My mother used to pretend to be a doctor, and she said she would take my call for me, and she would just tell people to take 2 aspirin and don't call her in the morning. And so she grew up in an era, I guess I grew up in an era where people took aspirin, and aspirin is a big thing on a cardiovascular menu, right? If you've had a heart attack, heart disease, people are instructed to take an aspirin a day. The reality of it is women were never included in that study, so we don't know if an aspirin prevents much in women. We do know that aspirin has a lot of side effects when it comes to ulcers and bleeding, and we really have to look out for the risk versus the benefits. But one thing that people may not realize is that aspirin may not be beneficial in people with cancer. A study was done that involved patients in both the United States and Canada, looking at over 3,000 people that had more of a high risk but non-metastatic. So there was an aggressive cancer, but it hadn't not metastasized yet, and they were given aspirin and 300 milligrams versus not. They broke it down into body size and duration, and found that there was an increase in cancer deaths in the aspirin groups across the board. There was another trial the same way done previously. Esprit trial looked at 70-year-olds with 100 milligrams of aspirin, and again, increased aspirin deaths. So, things that are benign, like an aspirin, that we think, we've grown up thinking bare aspirin, it's in everybody's medicine cabinet, it's not without side effects. So GI side effects, and if you've had cancer, might not be the drug for you to have on your medicine shelf anyway. Especially with breast cancer, because a lot of people may not die of breast cancer, but they may die of the side effects of the treatment of breast cancer, the majority of which die of cardiovascular disease. So again, this is a little bit confusing now as far as, so if you have an increase of risk of cardiovascular disease because you've had radiation, is aspirin your friend or not? Chances are it's not. So obviously more studies have to be done to look into it, but it's not something that people should just take without doing their own research, talking to their doctor. So if you've had breast cancer, I would talk to your doctor about aspirin and think about that a lot before proceeding. Can we live forever? I don't think so. I like to talk about health span versus lifespan. I think that most people would like to live a healthy life as opposed to a long life that required chronic care per se. But there is research looking at, what happens to our cells as we age. Certainly, if you look at human cells in a petri dish, they can divide about 50 times before dying. There's no real known data on how long various cells live in the body, but we have these cells called senescent cells. One of the terms that are used now are zombie cells. And the accumulation of these senescent cells that don't do their function, but they just kind of hang around like stuff in the attic, are associated with aging. And if we were able to get rid of the zombie cells, could we reverse aging and make people be healthy forever or longer? Somehow these senescent cells seem to avoid the body clearing them. There's a process called apoptosis where the body removes cells that are not functioning, but these senescent cells start to, again, override the body's ability of getting rid of them. One of the things that these cells do is they make inflammatory proteins called interleukin-6 and interferon gamma. And the thought being is that when you first start having zombie cells or senescent cells or cells that aren't working, the body sees these inflammatory proteins and then attacks the cells and gets rid of them. But the more and more we accumulate these cells, the body can't keep up, and now you have an inflammatory mess as well as zombie cells. So if there was some way to go in and get rid of these zombie cells, it would be great. This increased inflammation, again, associated with diabetes and heart disease, kidney disease, Alzheimer's, osteoporosis. Again, we can't clear bad cells out. There's more inflammation, and bad things start to happen. One of the other problems is that as we age, our immune system starts to function to not function well. The population of natural killer cells that we have starts to decline. Our stem cells start to decline. Our overall immune function starts to decline. And so this inflammation starts to take over. Part of the problem with, having excessive numbers of vaccines where we commit our natural killer cells to making antibodies directed at various viruses. Our immune system gets worn out over time. It's chronically exposed to toxins. Again, the adjuvants in vaccine, but environmental toxins as well. Our immune system is the chemicals that are in the food, the processed food we eat. So our immune system gets overwhelmed. We can't clear our senescent cells out, and we start to age and have bad things happen. Well, there's a new drug on the market, obviously, to potentially fix this problem or put a Band-Aid on it. And it is called phospholutoclax, but it blocks some of these proteins that prohibit cell death. It's been tested in diabetic mice and looking at the retina. There's been a couple trials looking in humans to try to get rid of some of these cells that cause macular degeneration in diabetics. There might be a little bit of benefit, but again, there tends to be, the side effects associated with some of these things, and obviously the cost. So they're also looking at other drugs that might be repurposed, and one is Dulaney, which is an anti-cancer drug. Spirocel is the commercial name, and quercetin. And you've heard of quercetin because quercetin is very much associated with having antiviral properties and anti-cancer properties, and especially along with zinc to prevent viral replication. Well, the drug, Spirocel, is very much cautioned in elderly people, so it's not really going to be an alternative in people that are aging because of all the different toxicities. There's pages of toxicities associated with it. So if you just take somebody that is trying to prevent aging in general, it may, the risk again, most likely will outweigh the benefits at a tremendously high cost, obviously. But quercetin, again, may be something that to look more into. And then there's another chemical that's in foods called phenestin, which also may help with senescent cells. Quercetin is found in predominantly in highest concentrations in onions and apples, but phenestin is highest in strawberries. So if you can get a hold of organic strawberries, it has the highest amount of this drug. Apples, persimmons, kiwi, and grape. I had to laugh because this paper never even mentioned nutrition, but the other thing that made me laugh was, because it'd be too easy just to eat a healthy diet, right, to try to prevent your cells from aging and to keep your immune function going. But all the people that are looking at fruit as bad, now we're coming up with all these wonderful things, again, anti-aging, senescent, getting rid of your zombie cells that involve high proportions of fruit. So don't be so afraid of apples, persimmons, kiwi, grapes, strawberries, and any fruit for that imagine. There's a lot more antioxidants and phytonutrients that might ultimately help you better than a $15,000 drug that for a month that may ultimately cause your heart to go bad. So it's a little discouraging that we devote so much money and so much dollars and sign up for so many things that may have extreme toxicity to help with something that we could have prevented in the first place with a little bit more planning on the fronts of exercise and nutrition. So when it comes to weight loss, less calories will result in weight loss. But how do we lose calories and preserve nutrition? And that's why I think plant-based nutrition comes in, because fruits are low in calories, high in fiber, high in antioxidants. So if we replace our processed bakery foods with fruit, we would go a long way to making things better. We don't need to buy things in a box and have them shipped to us that we just need to put together, because, again, they're going to be full of preservatives, salt, different things that we don't really need. We need to learn how to feed ourselves again and go back to our kitchens, buy the organic food, learn how to make it, and just keep it simple. It's greens, sweet potato, another vegetable, a great dinner. Does not have to be a complicated 6-page recipe. Fruit for breakfast, a piece of salt, sourdough toast, great for breakfast. Oatmeal, great for breakfast. Some chia seeds. It doesn't have to be complicated. A large salad. I am a huge proponent of eating and chewing your food, not drinking your food. Unless you are desperately trying to get calories in and you're having trouble, especially if you're overweight, ditch the smoothies, eat the food. And if you were to put everything that goes into your smoothie in a bowl, you would be surprised at the quantity of food that's involved in those. And again, if you go out to some of these places and get the bowls or the smoothies, they're additives. They're additives, usually sugar, honey, all kinds of caloric additives are added to things that people conveniently forget, or it's not noted. When people get grains out, typically the grains are going to be cooked in oil so they don't stick together while they're waiting for people to make orders. So nutrition label reading is needed, and a lot of times it's not available, so your best is to stay away from it. Tonight I will be having eggplant from the garden that I will season with oregano and garlic and bake. I will top that with a Momo sauce using a just tomato puree, organic tomato puree, that I'll put a couple hot peppers from my tower garden, as well as ginger and fresh garlic and some allspice to make the sauce, so it'll be spicy. And I'll have another vegetable. I said, if I didn't say bok choy, I'll have some mushrooms with that. So that's my dinner tonight. Dessert will be frozen bananas, blueberries with a little cacao powder and soy milk. And it'll be a great evening. So I hope you get your exercise in. Think about your brain when you don't want to go to the gym or you don't want to do strength training. If you don't want to go to the gym, lift some things outside, carry heavy objects, do body weight exercises at home. You can buy some bands on Amazon that you can do a lot of great body weight exercise with. And not have to leave the privacy of your own home. Go for a walk in your neighborhood, get some sunshine, and life will be good. Thanks for listening.